So welcome to this session. We are going to look at organizational development in the context of healthcare organizations or in the context of healthcare management. So in this session, we shall look at the nature of healthcare organizations and why organizational development is very important. And also, we shall look at the different roles or benefits of organizational development and what are the skills or competencies that organizational development practitioners should have in facilitating change. So first of all, for us to look at this topic clearly, we need to first understand the nature of healthcare organizations. Healthcare organizations fall into the category of what we can call complex organizations because you have a number of departments. If we look at, for example, an advanced hospital, or what you can call a tertiary hospital. A tertiary hospital will have the different departments, the surgical department, medical department, will have the OPD, outpatients department, will have the pharmacy, the laboratory, and many other departments, the obs and gyn, pediatrics, and other departments. So these departments make the nature of health organizations very complex because you have different health professionals working together. Okay, so they have health organizations have different specialties and these professionals working together in a coordinated manner. And then the other thing is that health organizations these days are now focused on patients. Okay, the patient is at the center of the care that they actually receive. So they participate in decision making. The organizations work towards making sure that patient outcomes are improved. Patient satisfaction is also maximum. So you have a lot of things written around the patient. The other thing also is that you have many authorities regulating the healthcare industry. So compliance with these regulatory requirements is usually very complex. So for example, you look at the requirements for practice for the different professionals, the nurses having their own regulatory council, the doctors having theirs, and then you have the pharmaceutical regulatory authorities, which you can call the drug and the food and drug authorities of different countries. So you have a lot of regulations that you will have to comply with, and this actually makes healthcare more complex. And then you have a lot of people working together, of course, different people with different levels of specializations working together for the benefit of the patient. And then the other issue is that you now have a lot of incorporation of technology into the healthcare industry. A lot of things, or technology actually keeps evolving, and as it evolves, healthcare organizations actually need to adopt. So there are many ways in which technology has actually impacted the healthcare industry. The industry actually faces a number of challenges, and the cost of healthcare is increasing. This is related to, of course, the equipment, maintaining the personnel, and also procuring the supplies, medications, and also keeping it in touch with the advanced technology. These things actually cost money, and there is need to actually maintain costs at a level that will allow healthcare facilities to actually make profits. And then the population is now increasing in terms of composition of the old age individuals. So the aging population is actually increasing. This has implications. One is that aging individuals often have chronic conditions, and these chronic conditions actually require a lot of resources to manage. Conditions like hypertension, diabetes, these are chronic conditions that require continuous treatment or management. And therefore, this makes the healthcare costs actually to shoot up. And these individuals also have specific needs that will actually need to be addressed separately. And then the other issues are that, of course, the focus being on the patient, you want to make sure that the patient actually receive high quality care. And of course, this is also has an impact on the healthcare costs. You need to make sure that you don't harm the patient. There are no medical negligences or medical errors. So you need to make sure that actually the patient's experience within the healthcare facilities is optimal. So that comes with its own challenges. Recruiting and retaining skilled health workers is also a challenge. They come at a cost, okay? They come at a cost depending on their level of specialization. Specialists will require more resources to keep than, let us say, for example, mid-level health workers, okay? And then you don't actually have enough health professionals because of the costs, and therefore managing workloads becomes very, very challenging. The healthcare industry also incorporates issues of having to deal with data. Data about patients is huge, and much of that these days is electronic data, and maintaining all this data that is actually electronic, whereas making sure that patients' privacy and security is maintained becomes a huge challenge. So there is need actually to invest in a lot of cybersecurity measures, and this poses a unique challenge to healthcare organizations. So what are health organizations actually doing to handle some of these issues? One, of course, they are adopting the new technologies. This helps in improving the quality of care delivered to patients. So their use of digital mobile applications, telemedicine, and also artificial intelligence and data analytics to improve healthcare delivery. And then there is also a shift in terms of people paying for the service to models where you have value-based care. The emphasis is on quality outcomes, and also making sure that for every intervention that is done, the costs are actually minimized, so that you can achieve cost effectiveness. A lot of focus is now on the patient. The patient has to be involved in their care. So this is what we call patient-centered care, where patients are involved in decision making. Promoting collaborations and teamwork is very key, given that we have different professionals working in the healthcare organizations. So therefore, it is very important to work as a team and also collaborate. And then the last point is that healthcare organizations are now focused more on health promotion or preventive care. This is actually more effective than treatment of chronic conditions such as hypertension, diabetes, and others. So it is better for health organizations to actually focus on making sure that these diseases don't happen in the first place. Or if they are to happen, then the outcomes are actually better if the detection of these diseases is done earlier. So now, moving to, after understanding the nature of health organizations, it is now very prudent that we introduce the concept of organization development. Why is this very important? We have realized that the healthcare industry is experiencing a lot of pressures from technology, from making sure that the patients are satisfied with the kind of services, and also making sure that they're effective while maintaining costs. Now, those aspects make healthcare organizations very unique. So, and therefore, health organizations need to be very, very dynamic, such that they can respond to these issues and making sure that they can actually remain with a competitive advantage. And therefore, to do that, you actually need to invest in organizational development. So organizational development as a concept is defined as a planned and systematic approach to improving an organization's effectiveness, efficiency, and adaptability. So you want to make sure that the organization actually adopts to what can make it more efficient, effective, okay, efficient and effective. So you want to have, if you actually maintain effectiveness and efficiency, it means that you're going to be able to meet the needs of your clients, and therefore you'll be able to survive in the market and have that competitive advantage. So the key things are that it is systematic. It is not, it does not happen in a random way. It is a systematic approach. And that means that there are steps that have to be undertaken for you to achieve that. So it is planned, okay? It is planned, it is an ongoing process of making sure that you actually improve a lot of areas in terms of the structure, in terms of the systems, in terms of the personnel, in terms of performance capacity, and everything. So that's what I can say about organizational development. So, like I've said, you want to improve about in all spheres. You want to improve the performance of an organization in all spheres. In all spheres, I mean in terms of the processes involved in the healthcare organizations, the people working in the healthcare organizations, their relations with one another, the team spirit, their culture, how they engage themselves, how they develop as managers, as leaders, as how culture can be transformed. So organizational development is actually a broad way of addressing various aspects of the organization. Okay, so you look at the organization holistically, and then look at the different aspects of this organization, and then see how this organization performance can actually be improved. So in healthcare organizations, organizational development is aimed at making sure that the patients actually get the best care possible, and that care should be provided in an efficient and safe way. Okay, efficient and safe manner. That is very key. There should be effectiveness and also efficiency. Okay, and then the third one is that there should be a positive organizational culture and employee engagement. And then the last one is that organizational development in healthcare actually facilitates strategic change and innovation. This is to make sure that everyone within the healthcare organization is aligned to the strategic direction of the organization. And the strategic direction of the organization, of course, will involve changes or will involve innovations, transformations from one area to the other. So all the team, the health team, or all the professionals working in the healthcare organization should be aware and aware of the strategic direction of the organization, and that they can actually adopt to the new innovations or changes that come along. So what usually happens in the organizational involvement, that you want to first understand the organization. Okay, so you carry out organizational assessments. And when you're doing organizational assessments, you can carry out a number of interventions or studies or tasks to understand the nature of the organization. So you assess it. So you carry out organizational assessments. You want to understand the strength, the weaknesses, the opportunities within the organization. So you carry out organizational assessments. And then you start to do what you call strategic planning, long-term plans for the organization and how you want to reach there. And then developing leaders, making sure that the culture is appropriate, or the culture, organizational culture is aligned with the strategic direction of the organization, team building processes, process improvement, employee engagements, continuous learning and improvement. Okay, so that means that if you are an organizational development practitioner, you should have the skills in all these areas, in areas of organizational development, organizational assessments, strategic planning, leadership development, cultural change initiatives, team building, process improvement, employee engagement, and continuous learning and improvement. For you, you should be having these skills in addition to being a good communicator, a good facilitator, should be very good at data analysis, and also should have expertise in project management. So you realize that, of course, organizational development brings about changes that would make an organization to be more effective, more efficient, and also it also brings about issues to do with the culture, organizational culture, realigning with the strategic direction of the organization, and many other aspects. So all the things are quite delicate, because employees may not actually embrace the strategic direction that the organization is undertaking. And that means that they will have fears, or they may be resistant to the changes that will happen because of organizational development. So it is very important that organizational development practitioners understand that they need to be respectful. They should be people of integrity. They should be very transparent. They should also recognize that people have diverse values. There's diversity. These are very important, including confidentiality. Organizational development efforts may not be effective if they are not done in a transparent, respectful manner. It's very important to maintain confidentiality, transparency, and integrity. This, of course, will create an environment that will allow the employees of the organization to share information really because they trust what they say, because you are a credible person. So it is very important to have or to foster that kind of work environment. Therefore, organizational development is actually very, very, very important because it helps in addressing these unique challenges that face healthcare industry. The healthcare industry or healthcare organizations can navigate these challenges by ensuring that they invest in organizational development, and the results of the organizational development will be improvement in patient care, quality of care, employee satisfaction and engagement, and therefore overall improvement in healthcare outcomes and organizational success. So how do you go about organizational development? The first thing is first understand the organization. That's the first step, which we earlier on called organizational assessment. We can call it organizational diagnosis, which is basically assessing the current state of the organization, identifying the areas that need improvement, identify areas of strength and weaknesses. And then you can now decide on what to do to address the areas of weaknesses identified. Then the next step is to implement these planned interventions and then evaluate the interventions that have been implemented. And then that actually marks the end of the organizational process. But it's actually a cyclic process. It's a cyclic process. It involves moving from the first step to the next and then going back. Okay, and also adjusting along the way if there is need. Okay, so that is what we call organizational development. We have looked at what it means, its importances and objectives, why health organizations actually need to invest in organizational development. We have also finally looked at organizational development process. Thank you very much.